Welcome back. This Health Week segment is brought to you by the Center for Plastic Surgery on Michigan Street in Grand Rapids. Droopy eyelids can make you look older and tired. They can even cause problems when it comes to your vision. Dr. Doug Lepink is here to talk with us about why an eyelid lift might be an option for you. I don't know, right around this morning, I think we're all in need of some eye unpoofingness. So if you could help us with that too, that'd be great. Now tell me a little bit about the eyelid itself. Like, why is that an important part of like a facial rejuvenation when you go into something, have something like that done?
Well, I think it's because we express ourselves with our eyes. When we sit down to talk to someone, we might notice a new hairstyle, for example, but really we have to concentrate on what our eyes are saying. Our words may say one thing, but our expression through our eyes may say something different. So we really have to concentrate on our eyes and make sure that we read each other's eyes. And so a youthful, alert, fresh-looking eye is really part of being attractive to someone.
Now, there's a difference too, because there's an upper eyelid surgery and then there's a lower eyelid. So what is the difference between the two?
In upper eyelid surgery, the focus or the first priority is removing extra skin. I think everyone feels that they have a little extra skin in their upper eyelids, and just kind of freshening up the contours of the upper eyelid by removing skin and perhaps a little bit of fat and muscle. The lower eyelid is totally different. In the lower eyelid, you really take very little extra skin. Most of the focus there is to either reposition the fat or remove perhaps a little extra fat that can protrude as we get older and our tissues get a little weaker.
Gotcha. So I think this is something that we're talking about right here, like this,
right.
The graphic that we're showing.
On the upper eyelid, we're removing a strip of skin, perhaps a little bit of the fat underneath. But again, the lower eyelid, there are three fat compartments that we have to address. And it used to be that we would take a lot of fat out of the eye. The old starlets from the 50s.
Oh yes, I remember this.
With kind of a sunken-looking eye,
yeah.
Was the vogue in those days. But today, we really want to make sure that we don't hollow out the eye. I think as we get older, the eye can look deflated.
Oh, sure.
And today, we want to try to leave the youthful fat that's there and perhaps just reposition it.
So tell me a little bit, who would be a good candidate then for an eyelid surgery?
Well, first of all, you have to be in good health, and you have to have good eye health. We want to make sure that we don't put you at any risk in terms of affecting your vision. But someone perhaps who feels that they have extra skin in their upper eyelids, someone who feels that their eyes look tired, or perhaps they have a somewhat angry look, those would be people that, that perhaps would be a good candidate for this procedure.
Now, you also brought along some before and afters, which I think are always interesting. So let's take a look at those real quick. Now, this is a before and an after. And I feel like in the after she just looks more like awake and alert.
And that's, I think, the point. We're not trying to change the appearance of your eye or change the shape of your eye. What we're trying to do is to freshen your eye, make you look a little more alert without removing a lot of extra skin. We want to leave, again, that youthful, full look to the eye.
Now tell me a little bit about the anesthesia for this too, because I think anytime you hear surgery, your second question is, okay, am I a little under, a lot under, or how does it work for that one?
We usually do this under a little sedation and some local anesthesia, a little numbing medicine. The reason for the sedation, obviously, is we don't really feel comfortable having someone working around our eyes.
I don't want to look while that's going on.
No.
Exactly.
So the sedation is not really for pain. It's just to make you feel comfortable about the procedure. This can be very easily accomplished with local anesthetic. It's not a very painful operation. In fact, most of my patients do not use pain medication after surgery.
That's pretty good. So it's a pretty short recovery time, because that was my next question.
I think that for getting back with a little makeup on to your job, we're talking about a week. We would want to avoid strenuous exercise for longer than that, perhaps even 4 to 6 weeks, depending on how strenuous it is. But most patients can get back to their life easily within a week.
That's pretty quick. Now, how long does the overall effect, like if you have the whole thing done, how long does it last?
It's pretty rare to do a second eyelid lift on someone.
Oh, that's good. Okay.
I think that that obviously it takes several years before you get to that point, and there appears to be some effects of the surgery that perhaps maintain that youthful look of the eye. So it's pretty rare. Usually it's a one-time surgery.
All right. Well, that's a good thing. Well, thank you very much for sharing all of this today. I'm sure we're probably going to be calling you in a couple years. So thank you very much for sharing all of this with us today. Of course, you can find more information on the Center for Plastic Surgery on our website at WZZM13.com. Just click on the Health Week icon. When we come back, we're going to check out some breathing devices designed to